Hi, everybody. It's Dr. Chris here. It must be Tuesday for my weekly show of Optimal Health, Optimal Life. I hope you've had a great week. I've had a very busy week, and of course, I'm still happy to come here and talk to you all. Tonight, I'm going to be talking about optimal fertility. So, fertility, believe it or not, has been the rate has been going down. In 1880, the total fertility rate for the United States was 7. So that means that for like every person, there would be 7 people, right? Today, actually, this is from the 2018 data. They don't have it yet for 2020, but the total fertility rate in 2018 is 1.7. So right now, we're not even able to reproduce ourselves. We need at least a 2.08 rate to be considered a replacement level. So is it any wonder why we hear about couples having trouble getting pregnant? So that's why I thought, you know what, I'm going to come and talk to you guys. I've been talking to chiropractors for about 20 years about this, and I have helped quite a few patients with their fertility. So I think I have some things to offer. So basically, a definition of infertility is the inability to conceive or carry a pregnancy to term after 1 year of unprotected sex. And right now, the infertility rate in the US is 15% of couples, and that is 1 in 7 couples. 1/3 of the time, the problem's due to the male, 1/3 of the time, and then there's the female, and then there's the two together. So it's like a third, a third, a third. And then for babies born in the US annually via IVF, it's 1 to 2%. And the average cost for a single IVF treatment is $10,000 to $15,000. So this is a costly endeavor. It's not just a simple thing. So I'm going to start off talking about female fertility. We'll see how far we get. If I need to, I'll continue this next week. But for female fertility facts, try to say that 3 times. A female is born with all of her eggs, which are about 1 to 2 million. At puberty, only 300,000 remain. So over a woman's lifetime of reproductive cycle, which is 30 to 40 years, the entire egg supply is going to deplete in that time. And about 300 to 500 of these eggs are going to mature over a woman's lifespan. So it just tells you that this is what we have to work with, right? Women are born with whatever they have, and we want to make sure that those eggs don't age in a fashion before she gets to use them, because those eggs and their capacity to do what we want them to do is going to depend on her lifestyle and what she's exposed to, not only in utero as her mom was developing her, but then also in childhood and then beyond. So this is something really to think about. And obviously, there's nothing we can do once we have our eggs, right? But when we're thinking about when that fetus is forming inside of us, if she's a girl, then we're actually prepping her female fertility for the future. So pretty cool to think about. So we need to know about the menstrual cycle, because that is going to dictate if our body is ready to have fertility. Most menstrual cycle lengths are about 24 to 36 days, and that ovulation day is going to determine the length of the cycle. And an unfertilized egg can only last 48 hours. So there's timing in this. We have to have the right timing. That menstrual cycle is dependent on our female hormones. So we start off day 1 of the menstrual cycle. This is called the follicular or estrogenic phase. And this is where we start to have estrogen being produced. And this is regulated actually by the pituitary, which is producing luteinizing hormone, follicle stimulating hormone, and is getting our body ready so to ripen that ovary follicle for the egg to be released and to make that lining of the uterus prepping for this implantation. Then at ovulation, you are going to start this luteal or progesterone phase. And this goes from ovulation to the day before your menses if you are not fertilizing the eggs. So that's about 12 to 16 days. And this is a really crucial time because we need that period to be at least 10 days in order for a pregnancy to take if there's fertilization during ovulation. So this is really important to know because if we don't have enough estrogen, we're not going to be able to induce ovulation. And then if we don't have enough progesterone, we're not going to be able to keep a pregnancy going. And this is where it comes in. When I have patients come in, I will actually check out their hormones. And I do it using saliva because I find this to be a more reliable way. And if I want to, I can look at the entire cycle. She's got a kit that she's got at home, spitting into a tube, and we can do it throughout the entire menstrual cycle so that we can get an idea of what is actually happening during those phases. And if you do not have any idea about your hormonal cycle and what it does, I recommend a book, and I'll put it in the description, called Taking Charge of Your Fertility. And this book has been around a long time, but that information is still the same. And I feel like this is a book that every single woman should read to understand what actually goes on in their body for menses and or to become pregnant. All right, so let's just say we've got a fertilized egg and there are hormones of pregnancy that are then needing to come into play. So number one being progesterone, and this is what's going to keep the pregnancy going. This is first secreted by, there's a little follicle left over in the ovary called the corpus luteum after the egg is released. And this actually produces the first bit of progesterone needed to keep the pregnancy. And that's for about 6 to 12 weeks. Then the placenta is going to kick in at about 12 weeks. And this is kind of a crucial time because you've got the corpus luteum, that progesterone's going down and you're starting to build up the placental levels. And it can actually create a little physiologic dip in progesterone. And this is sort of a challenge period to see if the pregnancy is going to take. And this is why a lot of miscarriages occur early on in that first trimester when that progesterone challenge occurs. Then there's something called a HCG, human choreographic gonadotropin. I think I said that right. And that's going to raise really, really quickly after fertilization. It's going to be a huge spike. And then after the first trimester, it starts to drop. Well, go figure. First trimester, you might have brutal morning sickness because of this HCG, and it's really there to make sure that this pregnancy is going to take. And it's really protective. It might make us feel miserable, but it's something that is necessary. And this is also a way we can tell if a pregnancy is taking, because we can level those measure those levels of HCG. And then after that first trimester, those levels are going to drop. And that's when women start feeling better and not so nauseous and tired and whatnot. Okay. So I'm going to talk a little bit about the causes of infertility. And there's many, many causes, but these are some of the more common ones. And that includes things like endometriosis, infection and illness, pelvic inflammatory disease, pelvic surgery, polycystic ovary syndrome, MTHFR gene mutation, hormonal imbalances, hormone disrupting chemicals, chemical and radiation exposure, EMFs, heavy metal toxicity, cigarette smoking, alcohol, caffeine, vitamin deficiency or excess, and drugs that are over the counter, prescription, or recreational. So this runs the gamut from things that we do in our lifestyle and things we're exposed to kind of metabolic imbalances. So even some additional ones could be too vigorous exercise, uses of douches, lubricants, sprays, scented tampons, weighing too much, either overweight and obese or underweight, improper timing of intercourse, stress, consumption of animal products, herbs, age, and actually one that I am really great at helping with is subluxation, which are the misalignments that occur in the spine that affect that connection between the brain and the rest of the body. Because guess what? Our hormonal system is controlled by the brain. That pituitary gland is in our brain, which gets feedback funneled down into it. And it's this feedback loop from the organs in our body to our brain, whether we're going to make those hormones. So if you're not having that top-down control because of subluxations, misalignments, whatever you want to call it, then your body's not going to be able to function as well as it should. And this is why chiropractic can help restore balance in the body and function, including with fertility. So it's pretty cool that we can do this. So, I'm not going to go into detail tonight about all the things like endometriosis and pelvic inflammatory disease. I do want to say about PCOS. This is called polycystic ovarian syndrome. And this is where women have a conversion of testosterone to estrogen. So there's too much of that going on. They have too much of the male hormone because we all have some, but in this case, it's too much and it's getting converted into estrogen. And what that does is that through that feedback hormonal system, it actually decreases follicle stimulating hormone, and therefore they often don't ovulate. Follicles turn into cysts, hence the name. And there's definitely some things that I can do nutrition-wise and to lower a hormone called prolactin that sort of perpetuates all of this. There's also connection with weight and etc. So there's a lot that can be done for PCOS naturally. I do want to talk a little bit about female hormonal imbalances because there are so many things that we are exposed to that affect our hormones, like endocrine disrupting chemicals. So those are the things that are in our waters. So they get deposited into fish and then you eat the fish and then that disrupts our system. They actually act like estrogen in our body. They're called xenoestrogens, xeno meaning foreign, but it becomes too much. It's not a proper balance as to when we make our own hormones. They act differently and they create that imbalance in our system. The other thing that creates, that's an endocrine disrupting chemical that women can find really commonly is in their makeup and skincare products and body care products. It's full of these endocrine disrupting chemicals and hormones. So I did a whole show on skincare and toxins. So go back and find that. I'm going to put it in the description so you can find it easier. And plastic. So things like BPA. I know now that plastics will say, oh, BPA free, but then there's still other chemicals and plasticizers that have similar effects. So my recommendation is to try and avoid as much plastic as possible in your life, especially things that come in contact with you and that you're putting in your body. Thyroid problems are another source of female hormonal imbalances, and I can check for that in the office. I usually do a blood panel. That's very similar to how medical doctors work, but it's how I look at the results. So when you look at values functionally rather than pathology, it means that my criteria for normalcy and balance is going to be like this. I don't want to get you out to those extremes. And then once I have that information, I can give recommendations of what are some things that can bring you into balance. And then there's this whole aspect of medical doctors only checking TSH, which is thyroid stimulating hormone. It's a pituitary hormone, and they're not doing a full thyroid panel. So I always want to make sure that that is done. And then that we're not confusing hypothyroid with Hashimoto's disease, which is an autoimmune condition. So these are all things that I have to look at. I'm also looking at anything else that's going on in their life that might be making those hormone imbalances. Let's see. Oh, and then the other thing I totally forgot about to mention this with the chemicals, but the perfluorochemicals, the PFOAs, you'll see that used to come from things like Teflon. It still can come from nonstick cookware. But food wrappers, textiles, clothing, microwave popcorn, anything that has that nonstick coating on it is going to have these PFOAs, which are super, super toxic. And they can also get into our water, which is a whole nother topic because we've got these chemicals that we don't want to do the bottled water because of the plastic bottles, but tap water also needs to be filtered. And I'll be doing, we did a podcast on your baby's brilliant brain. That will be coming out probably in about a week. So look for that, where we talk about these chemicals in the water and how to make sure that you're getting them out. All right. So timing and fertility awareness. I have met so many women trying to get pregnant who have no idea about what's going on with their cycle. They're just relying on ovulation test kits. And to me, that's not enough, or apps. It really is important to be doing fertility awareness, which is where you're looking at your basal metabolic temperature, your cervical fluid, and possibly even palpating your cervix to know exactly what is happening so that you know exactly when you're ovulating. It's not that you have ovulated, which I believe these test kits are letting you know, but it may be almost too late by the time that happens. So I won't go into detail about it, but you take your temperature first thing in the morning with a basal thermometer. It's got a limited scale on it. And when your temperature spikes, you know you are ovulating. So that's the key. You also, if you continue to take your temperature and it stays elevated, you're going to know that you've become pregnant. So this is one of the very first ways that you can tell what is going on rather than just waiting for a positive pregnancy test. It's also going to let you know if your length of your luteal phase, remember that secondary phase, is long enough to be able to maintain a pregnancy. It also will let you know if the pregnancy is not taking, so that if your temperature is rising and then it starts to drop, you know that there is probably an imminent miscarriage. And, this is, it's unfortunate, but it happens. And it really does happen more than people realize. But it's the way that the body is just letting you know that this wasn't something that was going to work in general, in most cases. Sometimes there's other medical issues that need to be looked at. But in general, it's nature taking its course. For the cervical fluid, what you look for is fertile fluid that is super stretchy. So you put it between your fingers and you see if it is stretchy. And it's an egg white color, and this is actually going to help the sperm survive longer to be able to fertilize. And then with the cervix palpation, this is one of those things that it's a little bit trickier and it's optional, but if you feel your cervix, it's going to feel more like your lips, so softer than your nose, which is a little harder. So this is all in the book that I mentioned, Taking Charge of Your Fertility, along with now there's charts that you can get off the website. So it's really cool that you can kind of keep track. All right, so when I have a patient come in, what do I do if they want to get pregnant? First of all, I recommend that you come in a few years before you actually want to conceive so that we can get your body prepped for conception, right? We want that best egg to be released and meet the best sperm. So I do what I do with everybody. I do a history and I do a physical and a chiropractic exam. Everybody gets that. I might look at a stress response evaluation. Remember, I told you stress can affect fertility. It has extreme effects on the body. Well, the mind, body, spirit is all connected, right? I do hormonal testing. I will look at blood tests and urinalysis. Either I'm ordering it or I'll look at what a patient has. We might be doing genetic testing depending on the history. Autoimmune testing, gut function testing, heavy metal testing. And then I will look at what the patient has done if they've worked with a reproductive specialist, if they've done any special testing. But I'm really looking for reasons why they're having issues because I always want to get to the cause of what's happening. And then as I work with them, it's going to depend on what I'm finding on this workup. It's always going to be individualized. There's no one size fits all cookie cutter program because everybody is so different. So yeah, that is basically, that's my optimal fertility, is trying to look at everything going on in the woman. And then once I have an idea of where there are imbalances, I'll do the chiropractic. We may do my abdominal massage, and that's a whole nother YouTube show. I'm going to look at her lifestyle and make sure there aren't some things that we can do there. I'm going to look at her diet. I'm going to look at what she's taking supplementation-wise and herbs and maybe make some recommendations. Exercise history, stress, we may end up doing some neurofeedback. Looking at the emotional component of what is happening with either before she tried to get pregnant or even the stress that's gone on by attempting to get pregnant. Look at any emotional components, and then sometimes I will do something called Neuro Emotional Technique. And again, sort of spawning off this YouTube show, definitely something I'll be talking about soon. All right, so next week I will talk about male fertility because this is all the time I have today. So thank you for joining me. If you have questions, you can reach out to me. I'll put my contact information in the description. Otherwise, give me a thumbs up if you liked what I had to say, and let your friends know. And please subscribe so you know when I am posting a new video. All right, everybody, have a great week, and I will see you next Tuesday. Bye.